I wanted to talk a little bit about the US domestic coronavirus response and then also about our global mission and mission in the region, and then we'll be happy to take questions later. So just briefly to talk about our US response, we have a whole of government approach to get and keep America open. And as of May 26th, there have been 1.662 million confirmed or probable cases in the US and 98,261 deaths. CDC is focused on publishing the latest data on the web, on providing guidance for mitigating the outbreak in the US and in globally, and on working on getting and staying open. And one of our primary goals right now is to cooperate closely with communities across the US as they consider approaches to mitigate and contain COVID-19 in preparation for opening. We have many decision tools for reopening, and many of these are on the web, and I do encourage people to look on the web, and we're also happy to provide those links for people who need them. Across the US, states and localities are in different stages of the pandemic, and we're trying to help these communities understand where they are and make decisions based on where they are and where they want to go. One of the things we focus on is surveillance and testing, and I'll talk about each of those for just a minute. We rely on a combination of data sources for our surveillance strategy. That includes adapting our existing respiratory and influenza surveillance systems for coronavirus, case reporting, commercial laboratory reporting, syndromic surveillance, ongoing research platforms that are specifically geared to coronavirus, and developing new systems to answer specific questions as they arise, and to look for specific diseases and syndromes that are associated with coronavirus, for example, in children recently. We need to keep the whole system in mind and look at how the pandemic is affecting the health system and what the ripple effects are and how to try to mitigate some of those effects. Addressing in COVID-19 has really been a lesson in the connectedness of countries and the globe. And I think that we will use this opportunity to try to strengthen our global health programs. Our leadership around the world is now recognizing even more the connectedness of the world and health threats, and that diseases know no borders, and that a disease anywhere is a disease threat everywhere. And as Dan mentioned, Dr. Singer mentioned, we have staff in over 60 countries, including in the region that we're talking about now. We focus on technical assistance and technical collaborations, and it really is a two-way street where we learn and countries learn, and we can build up capacity together to prevent, detect, and respond to infectious disease threats. Coronavirus is providing us an opportunity to look for areas where we can strengthen those collaborations more. And we want to work with other countries to identify areas that we can work more for situational analysis, for increasing capacity to detect and respond, for COVID-19 transmission, but also for other infectious disease threats, for supporting critical needs of healthcare facilities and healthcare workers and public health personnel, for prevention and protective interventions, for ensuring preparedness and readiness to implement vaccines and therapeutics when they're available, to address One Health aspects of disease, including coronavirus, really being able to leverage global health expertise around the world. And one of the things that we're doing, and Ambassador Kolker mentioned, is CDC is working to develop a more sustainable, permanent overseas footprint that for where we can achieve our mission of working with countries to strengthen capacity to detect and respond to diseases. So we are we're starting with 4 regional offices, and one of them is for Eastern Europe and Central Asia, based in Tbilisi, Georgia. And we're just starting this office, and we're going to be looking for additional opportunities for collaboration. And that's one of the reasons I'm very excited to be here with this group, is that we will be working with ministries of health in the region to look for opportunities for collaboration. And our regional director in Tbilisi that we've hired is Dr. Chuck Vitek, who's here on the phone now, and we'll give him the opportunity to say a few words. And he will be moving to Tbilisi. We don't know exactly when, but as the situation allows, in the near future, to help stand up that regional office. So thank you. Happy to answer any questions, and I will pass it on to Dr. Vitek.